Hello, my name's Amanda Capino, and I'm a pharmacist and faculty member at the University of Mississippi School of Pharmacy, based here on the Medical Center campus. And my specialty is pediatrics, and clinical area focus is the NICU, or the Neonatal Intensive Care Unit. And opioids is one of the classes of medications that our patients may be on in the NICU. And today I'm briefly going to talk about reasons why neonates and pediatric patients in general, mainly in the ICU setting, may be on narcotics or opioids, and then preview what can happen if they're on these medications for an extended period of time when they're in the NICU or the PICU. So like I mentioned, I'm mainly going to talk about really the indications for pain management, specifically in the context of neonates and pediatric patients in the ICU setting. Before I specifically talk about the NICU and PICU management, one of the things I always want to bring up is that it's important to always know the history of our patient, and in the case of a neonate, the history of mom. And so one of the things that we can see is our babies, when they're first born, may have already been exposed to opioids essentially in utero. So mom may have been on a prescription pain medication for a certain indication, or there may have been illicit drug use. And so when the baby is born, if they were exposed to these drugs for an extended period of time, that is important to recognize. Because one of the things that we can see is they may withdraw from this medication. And so in the context specifically of this exposure in utero, this is referred to as NAS, or neonatal abstinence syndrome. And a newer term that is used is neonatal opioid withdrawal syndrome. So you'll see both of these terms used, but this is specific to neonates, essentially when they are born, if they were exposed to opioids in general in utero, and that's specifically the neonatal opioid withdrawal syndrome, versus NAS is thought to be a little more broad, that it doesn't necessarily have to be just opioids, but that is really what it's commonly thought to be. And then when we look at patients specifically in the NICU and the PICU that may not have been exposed to medications and opioids in utero, but they may require pain medications while they're in the NICU or the PICU. So there are a lot of different reasons why they may be on pain medications, but one common example that they may, if they have some kind of bedside procedure, like they're placing a PICC line or a central line for the patient, they may give a spot dose of a pain medication. But sometimes there may be more extended duration of pain medication. So say a baby had a really extensive surgery, so post-op they may be on pain medications for an extended period of time. So whenever I think about pain medications, it may be those just intermittent doses for a procedure, or it could be an extended period of time. And sometimes they may actually require a continuous infusion of a narcotic, such as fentanyl, morphine, or hydromorphone. And so they may be on these continuous infusions or drips for several days. And so if we cut that supply rapidly, that can also lead to withdrawal. And so it's referred to as IOAS, or iatrogenic opioid abstinence syndrome. So the main difference between the NAS, or the neonatal opioid withdrawal syndrome that I mentioned, and IOAS is really the source of exposure. So in the neonatal abstinence syndrome, it's essentially the baby was exposed in utero, and then once they're born, we may cut that supply of that drug and they're at risk for withdrawal, versus the IOAS is that we gave the patient the medication in the hospital essentially, and they may have been on an extended period of time, and that can lead to withdrawal. So in one of your future blocks, we'll go into more detail about NAS and IOAS and what that looks like and how we potentially manage that in our patients. So stay tuned for that.